This was an expanded efficacy and safety analysis with additional data. We have originally presented the data at ESMO 2020, and just a few weeks ago, the New England Journal of Medicine published our manuscript on April the 1st, 2021, with the first results of the Checkmate577 study. The trial was truly global in nature. We looked at 794 patients across 29 countries. Patients were randomized in a 2-to-1 manner, with 532 patients getting nivolumab, 262 getting placebo. Maximum treatment duration was 1 year. Primary endpoint of this study was disease-free survival, and the data we've shown to date is after an interim analysis of 24.4 months. We will continue the study for secondary endpoints of overall survival, which should be available in approximately a year. Overall, the baseline characteristics were well balanced across the treatment arms, with 80% of patients were Caucasian, 60% had esophageal cancer, majority of patients, 71%, had adenocarcinoma, and nearly 60% of patients had pathologic lymph node status of at least YPN1 in both groups. In terms of the primary endpoint of disease-free survival, what we'd shown previously was that we showed a doubling in the median disease-free survival from 11 months to 22.4 months in the nivolumab arm. This had a hazard ratio of 0.69, which equated to a 31% reduction in the risk of recurrence or death with the use of adjuvant nivolumab. Disease-free survival was maintained across multiple subgroups. Also, as we await for overall survival, we did look at additional efficacy endpoints. One was distant metastasis-free survival, which is defined as the time from randomization to that of the first distant recurrence or death, whichever occurs first. And what we showed was an 11-month improvement in the median distant metastasis-free survival from 17.4 months to 28.3 months, which is with a hazard ratio of 0.74, 26% lower risk of distant recurrence or death with nivolumab compared to placebo. There was also a difference in distant and loco-regional recurrences, which were less frequent in the nivolumab arm. At local was 12% versus 17%, and distant recurrence 29% versus 39%. And finally, we also looked at something called progression-free survival 2, which is the time from randomization to progression after the first subsequent systemic therapy or initiation of second subsequent systemic therapy. And we showed that also was significantly longer in the nivolumab arm, with 32.1 months in the placebo, and was not reached in the nivolumab arm at a hazard ratio of 0.77. In total, we also saw the safety. We showed some safety data, which really didn't show us any unusual toxicities, nothing that we haven't seen before. So this was very safe. The treatment-related adverse events, according to immunologic etiology, were also very small, with the majority grade 3 or 4. The majority grade 1 or grade 2, grade 3 or 4 events occurred in 1% or fewer, and there was no grade 5 select treatment-related adverse events. And finally, in terms of quality of life, we showed that this was very well tolerated. The majority of patients were not at all bothered or just a little bit bothered by treatment side effects. And the placebo arm and the adjuvant nivolumab arm looked very similar in terms of quality of life. So patients tolerated this really very well. So in summary, what we showed at our updated analysis at this year's ASCO was that nivolumab, adjuvant nivolumab in resected esophageal and gastroesophageal junction cancer shows clinically meaningful efficacy in those patients. We showed a 31% reduction in the risk of recurrence or death, and a doubling in the median disease-free survival from 11 to 22.4 months. We showed that disease-free survival benefit was observed across multiple subgroups, including histology, tumor cell PD-L1 expression, and PD-L1 CPS score, as well as pathologic lymph node, time from resection to randomization, and radiotherapy dosage. We also observed less frequent distant and loco-regional recurrences, and improvement in distant metastasis-free survival and progression-free survival too, all with an acceptable safety profile and maintenance of quality of life. So these results provide further support for the use of adjuvant nivolumab as a new standard of care for patients with resected esophageal and gastroesophageal junction cancer who have received neoadjuvant chemoradiotherapy with residual pathologic disease. And this has given formal FDA approval on May the 20th, 2021. Thank you for your time and your attention, and I look forward to speaking to you again.